So this is always a big question. Should we or should we not exercise when we are planning for pregnancy? Most probably the elders in the house are telling you to take rest all the time and telling you to eat good food, and you know that you're putting on more weight if you follow this advice. So let's bust a little myths here. Bed rest is outmoded and there is nothing like rest. We all have to be on the move, we have to be active. Just let's remember that the human beings are hunters and gatherers. As long as there was daylight, we were designed to be walking and picking up food and doing some work or the other. So now the opposite has happened. All of us are getting up at 8 o'clock, running to the offices, and we are sitting at the computers for up to 8 to 12 hours and doing nothing but pushing buttons. So we have to have some drastic changes in this kind of a lifestyle, because what we have realized is many in the urban cities of India are because of lack of exercise, they are becoming obese and getting a host of problems like diabetes and cholesterol problems at a very young age. So how much of exercise is good? When you are planning pregnancy, for the first 14 days of the cycle, you can almost do what you want when you're planning a natural pregnancy. When you are taking treatment like say IUI or fertility treatments like IVF, we generally do not recommend high intensity exercises. Now what is a heavy exercise or a high intensity exercise? If you're becoming breathless, if you're sweating a lot and if you're panting, that is a high intensity exercise like a cardio. Definitely not that when you're planning pregnancy with medications. So what about in the waiting period, in the post ovulation and in the next 14 days? This is also an anxious time, and if you sit and worry about getting pregnant, whether you're going to get a positive test or not, it's not a good idea. So try to do some light exercise like gardening, do your own household chores, or take a walk in the balcony in the morning and in the evening in the sunlight, preferably where you're going to get some adequate amount of vitamin D also. This is moderate exercise while attempting pregnancy. Now I just want to tell you a word of caution about high intensity training and training for long periods, for marathon running and all while planning for pregnancy. We do not recommend that, because science has now discovered that there should be a certain amount of body fat to produce estrogen and to have regular ovulation. So this we think is around 20 to 25% of fat should be there in the body. Practically what we see is in the gymnasts, in the athletes, in the badminton and players and tennis players, they have very irregular periods because the fat is replaced by muscle. So it's not very fashionable to have a completely muscular body. You should have a certain amount of fat, because that's how the feminine hormones work. If you have any doubts about exercise and you're used to doing some swimming or aerobics or some Zumba dancing, what I would suggest is sit with your fertility doctor, whether you're taking treatment, what sort of treatments you're taking, and then decide how much you should do and for how long you should do. The reason I'm saying this is when we give hormone injections, the ovaries tend to increase in size a bit. So if you are doing very high intensity workouts, they can undergo twisting and they can give you abdominal pain. So always while taking treatment, check with the doctor when you are planning your exercise routine. Stay fit and stay healthy, and then plan your pregnancy.